Hello, good morning. My name is Marta Pinto. I would like to start by thanking the invitation by David Martin to be present today. It is really a pleasure and an honor. So thank you so much for receiving me. I'm doing this video as a preventive measure since I'm contacting with you in a distance, and also because I'm in Mozambique working in harm reduction at this moment, and the internet is not perfect. So I really hope that this video won't be necessary to use, but if needed, here it is. Not in the best conditions. I'm doing the recording at my hotel room. But that's it. We agreed that I would share some of my ideas with you regarding the Portuguese decriminalization model, which is based on health, on the idea of health in its core. And I would like to share some of my perspectives regarding this issue. I would like to start to say that Portugal, before and after the reform, seems another country regarding drug use, if we take drug use in consideration, since the country has improved enormously since the reform was made. And if we take in consideration the most conventional indicators that are being used by the scientific community to evaluate the impact of drug policy around the world. And those indicators, the most common, are drug prices, imprisonment rates, substance use over time, drug-induced deaths, health costs, problematic drug use, HIV, Hep C, and TB incidence rates, and also the search for treatment for substance use disorders. I'm sorry that sometimes I look to the other way because I'm looking at the slides that I will be using at the presentation that will be shared with you. So Portugal is really a very different country regarding drug use. Before the reform, before the 21st century, we had around 1% of the population with problematic drug use, and at that time problematic drug use was mostly regarded as the injected drug use. So as you can imagine, there was a huge problem in the country, although Portugal is not usually a country with generalized drug use patterns. When compared with similar countries, our population in general tends to use less drugs than the other countries. But even so, we had a very large proportion of people using drugs who were having very deep problems with that use of substances. Also, at that time, whenever we asked the general population what were the main concerns of people, drug use was always in the first three places, because everyone had someone in the family or in the neighborhood having huge problems with the use of substances. Besides that, in the European context, Portugal has always had one of the worst scenarios of Hep C, HIV, and tuberculosis among those who use drugs, and particularly those who inject drugs. So we had a huge problem with this. Also, besides that, we had a very big concern with drug-induced deaths. We had higher rates than our neighborhoods in Europe, neighbor countries in Europe. And we also had a huge problem with oversized imprisonment populations. Our prisons were overcrowded, and most of the reasons for imprisonment were connected with drugs, and many were the consequence of drug use itself. So people were arrested because they were using drugs. They were seen as criminals. Well, in 1999, a commission of experts was created to design the strategy for the country. It was really a foundational document for our policy, and it was very avant-garde at that time, very progressive, based on human rights, on an approach that took in consideration human rights, first of all, security of people using drugs, but also security of the community, pragmatism, and so on. And well, that commission already spoke about in the national strategy that the commission created, already spoke about decriminalization of drug use, harm reduction, and so on. It was the first time that in Portugal harm reduction was officially assumed like a priority. Although we already had syringe exchange, for example, but it was put in place as an underground strategy. Mostly, in most of the cases. And well, in 2000, the law changed, decriminalization was assumed, and also in 2001, harm reduction was regulated in the law. We tend to see the Portuguese drug policy model as anchored in decriminalization. But this is not really true. I've made several studies trying to understand how Portuguese people see the drug policy model, and there is a consensual point of view that the Portuguese drug policy model goes is much more than decriminalization. I strongly believe that decriminalization in itself is important to decrease stigma associated to drug use, but it won't be sufficient. So our model is a very complex, I would say, system of care, of social and sanitary care, directed not only to drug users, to people who use drugs, but also to their families and their communities. And it is really a very comprehensive model. We really try to help people and take care of them and understand what is the meaning of the use itself for each person. Of course, we have problems, and this does not happen always, and stigma and prejudice are present in the care system. But I would say that in general terms, we really have a comprehensive response. And even our law framework has some problems, some issues. If you would like, we can share, we can discuss this in detail afterwards. I usually like to ask if the Portuguese drug policy model of decriminalization is the most adequate. And I don't have any doubts that when we face more conservative and repressive alternatives under the prohibitionist paradigm, this seems to be one of the best possible solutions. inclusively. In fact, the model has already been appropriated by conservative international bodies to support a narrative in favor of prohibitionism, saying that Portuguese is a living proof that prohibitionism works. And what I want to ask you is that should this be the way to build our future? If we think about the indicators that we are using for evaluation of drug policies around the world, we can see that those conventional indicators like infection diseases rates, as I said, substance use over time, imprisonment rates, drug-induced deaths, search for treatment for substance use disorders, and sometimes health costs and drug prices in the black market, sometimes drug-associated crime. I would like to ask, why are those indicators the ones being used? It seems to me that those are the ones relevant to social control and to public health. And in brief, my point of view is that those indicators are social management tools offering the individual the power to choose if he or she wants or not to use drugs, but at the same time neutralizing his or her effect over the community. The Global Commission on Drug Policy has said, and I agree at some point, that regarding drug use, we have come from hygienics to eugenics. What about indicators like socioeconomic reinsertion, citizenship, symbolic or social status, stigma, self-perceiving well-being, sense of belonging, housing situation, inequality in access to general health system? We don't have those types of indicators being used to evaluate our drug policy models. So, in my point of view, the main weakness of decriminalization in Portugal and in other countries is a structural one. The Portuguese drug policy model is health-centered. What we have done was to assume that people using drugs are not criminals. They are people in need for help, mostly health. So what happens if someone is caught by the police with drugs? This person, if this person is carrying the amount defined by the law as being defined as for drug use, this person will be conducted to a commission of dissuasion of drug addiction. And in those commissions, people will try to understand what that drug use means for the person and will try to understand if they are going to apply any type of penalization or not. Because we still penalize people who use drugs if we want to. And what happens in this framework is that the person gets in the health system. And this is a great advance regarding what was the previous reality. But despite of all the gains that I was trying to describe, the Portuguese drug policy model is still built upon what I like to call the drug fallacy. Decriminalization is a harm reduction measure. So decriminalization as well as harm reduction are fundamentally addressing the risks and harms of wrong drug policies and of social intolerance to diversity, and not of drug use itself. The link between, I'm quoting the Global Commission on Drug Policy, and I think that this phrase, this statement says a lot, so I will read it if you don't mind. The link between the perception of drugs, the people who use them, and drug policy constitutes a vicious cycle. Under a prohibitionist regime, a person who uses drugs is engaging in an act that is illegal, which increases stigma. This makes it even easier to discriminate against people who use drugs and enables policies that treat people who use drugs as subhumans, non-citizens, and scapegoats for wider societal problems. To end this communication, what I would like to share with you is that I usually use qualitative approaches to evaluate the point of view of people using drugs, of professionals working with them, with decision makers, with academics, and so on. And I try to combine this point of view with systematic reviews that show us what is all critically what is being produced or academically or scientifically around the world. And what I've been understanding, and if you want I can share my researches with you, what I've been understanding with the systematic reviews is that decriminalization is really a very good option within the prohibitionist paradigm. But at the same time, I do a lot of interviews, health diaries, and so on with people using drugs over time, and I can see what happens to them if we get to decriminalization basing our argument in health. What happens is that many times healthcare givers really take care of people, but in some sense they neutralize their effect on community because they don't become infected with HIV, tuberculosis, Hep C anymore. They usually decrease their criminal activity, so they are not a major concern anymore. And harm reduction measures are really very effective on this. And I've seen this in my country. After almost 20 years of the new approaches that we have implemented, it seems like for decision makers, for policy makers, it seems like people using drugs do not exist anymore. 20 years ago, no candidate for a public role would be a candidate without sharing his or her ideas on what should be done with people using drugs. Nowadays, we must do a great pressure to make decision makers talk about this, because drug use is not relevant anymore. It's not an issue. And why is this? Because we were very effective in silencing those persons. And for good reasons. They have decreased tremendously their health problems. But on the other hand, human rights are respected. Not very much. I've seen many people who are not ill anymore. They don't represent a menace to community. But they are profoundly unhappy with terrible lives. They haven't found a sense for their lives. Many times they are still homeless or in a very precarious situation. They are not a part of society, and they are just surviving. I would love to put you in contact with some of those people to make it easier for you to understand, but I can share their direct narratives if you are interested in, to see how this is true. not to all of them, of course, but to an important part of them. So I really think that decriminalization policies or regulation policies should be driven by human rights. And some countries have, for example, in Latin America, have decriminalized drug use based on the argument that it is the drug on wars is unconstitutional because it violates the right to self-determination and to the full development of personality. So these are the main ideas that I could share with you with only 15 minutes. I hope to be able to discuss more profoundly this with you, because I understand that in such a short period of time I cannot develop the argument as I would like to. You have my contact in the slide, so if you would like to keep discussing, please contact me. Thank you so much for this opportunity. I hope you have a good day of work. Goodbye.